Hi, all my smart little cookies out there. So today I am going to go over cranial nerves, but I'm going to try and tie it together so you can make some connections and kind of get the bigger picture out of things. So cranial nerves, what the heck are they? So your cranial nerves are in your head. So if you know the Latin, you can break it down that cranium or cranial is cranium. Okay, so there you go. Now, how do nerves work? So I'm going to explain that in a pinch. Terrible. I'm the only one laughing at my own jokes. Anyways, okay. So, how nerves work is imagine a hydro pole, okay? And when they're working fine, you're getting electricity to your house, your home, your to buildings, whatever. Okay, so you're getting power, things are working great. Okay, when the hydro pole goes down, you're not getting any power, any electricity sent to the buildings that it is supplying that electricity to. Okay, so same thing with your body. So if your cranial nerves, the nerves in your brain, do not function and work the way they're supposed to, then your body is going to be kind of shut down in a way. It's not going to be able to function the way it's supposed to. And so that's why it's very serious and important for us to check you out if there is a suspected concussion. Okay, so you're going to have an athletic therapist more than likely or a sports physiotherapist on site at an event, and we're going to be the ones that are going to assess you and make sure that you're okay. You'll follow up with a physician because they'll have obviously a higher level training, and so a sport medicine doctor, and they're going to make sure that everything is functioning, because if one of those structures stop working, it affects other ones, and then you end up having more complications and issues, and it reduces the quality of life. So I'm not trying to scare you about concussions or head trauma. It's just understand how your body functions and works so you can take better care of it. And to me, honestly, I would love it if you guys could understand and take care of yourself, that you feel independent and can feel empowered to do more with yourself than be dependent on all of us in the healthcare system. Because you know what, you guys can take good care of yourself for the most part, but we as providers maybe need to kind of enlighten and help to enforce better education with you guys. So that's what I'm gonna try to do here. So, okay, you get what's going on there with the nerves. All right, so then the next part is, what are the cranial nerves? Okay, so there's 12 of them. So let's see if I can rattle this off really good and easily. Okay, so there is olfactory, optic, ocular or oculomotor, trochlear, trigeminal, facial, abducens, vestibular, cochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So when we're testing you for all these things, they're very important. So the first one is olfactory, and that is testing your sense of smell. And so, there's some examples where it says like, oh, have a cinnamon stick and just wave that under them, and they should be able to smell that. And try to stick to something that's more recognizable or more familiar to that person. So if they've got, like say if you have a cup of coffee and the person knows what it is, you close one nostril, get them to inhale on the other side, and see if they are able to process that information. And if they're not able to, then obviously you'll have to go into more in-depth testing. But anyways, so that's that part in the pinch. So we're done with sense of smell. Okay, next part is vision. So you have optic, and some of these kind of blend in a little together, so it's kind of like gray zone. Anyways, so you have optic, and we're going to test your field of vision. And so we're going to check and go up, we're going to go down, we're going to go get your gaze medially. Okay, we're also going to see how your eyes respond to light, and so that's where they cover up one eye, and then or they use a pen light and flash that in your eye, and they test to see if your pupils are equal and responsive to light, or PEARL is the acronym. So for anyone like myself who have very, very dark eye colors, the iris is too dark, it might be a little bit of a struggle. So whenever we're doing scenarios in university and everyone's like, oh, okay, let's see, they're like, I can't tell, they're like, your pupils are responding, they're not, like, yeah, sure, okay, we'll pretend they're, yeah. So so sometimes you may have a struggle with that, so just keep that in mind. But what happens, why do we care? Well, if that's not functioning properly, then things are shutting down and not working properly. So again, that's when you're gonna get called for a lot more. So then we have TROCHLEAR, which is we're going to get you to look downward and laterally, and then olfactory, optic, ocular, trigeminal, no, trochlear, trigeminal. Okay, so we're going to check your face. So we're going to check, you can use a cotton ball, or if you have, if you can just have a very light touch on that person. So you're going to rub, gently graze your finger against their forehead, cheek, and then chin. Okay, and then you're gonna get them to also to clench their jaw. Okay, and see if they can do that. So then after abducens, which is checking the lateral eye tracking. Okay, so we're gonna check, you can use a cotton ball, or if you have, if you can just have a very light touch on that person. So you're going to rub, gently graze your finger against their forehead, cheek, and then chin. Okay, and then you're gonna get them to also to clench their jaw. Okay, and see if they can do that. Step is vestibular cochlear, and those nerves are responsible for your sense of balance and hearing. So if you have a clock that actually ticks and winds up, you can put that beside the person's ear and you can get test them to see if they can hear you. Otherwise, you can just try snapping your fingers. Okay, it's not bad considering right-handed. And you can test to see if they can hear that. You also want to test their balance and coordination. So, you know, have them stand on 2 feet, then single foot. You're going to have them eyes closed, eyes open, get them to walk, do tandem gait, basically kind of like a sobriety test. But only difference is we're checking to make sure that it's this is more medical related. So next one is glossopharyngeal, and that kind of ties in with the vagus nerve. So they're both going to test gag reflex, but the easiest way is to get the person to swallow. Okay, so get them to swallow, and if they can't, okay, well, that's going to have to get checked out. I know, right? Next one then is accessory. So you're going to get the person to shrug their shoulders. You can apply resistance to them and see if that works, if they are struggling. And then the last one is HYPOGLOSSAL, which is you're going to test the mouth. So you're going to stick your tongue out. Okay, you're going to then stick your tongue into the other side of the cheek. Okay, and then so you're basically looking to see, is one side, is it symmetrical? If it's not, if it's asymmetrical, what's going on, what's been damaged, and go from there. So the 12 cranial nerves, they're super important because they're going to tell you which part of the area in the head has been damaged and what's going on, and it's going to basically help whoever the healthcare provider is, whether it is your athletic therapist, sports physiotherapist, sports medicine physician, or surgeon, or whoever else it is that's going to be seeing you and treating you. All those little things that we take from whatever you are as the puzzle piece and then kind of put it all together, and that mishmash of that puzzle to solve what's going on and figure out things. So, so review, it is you want to, so to do this, go through a flow, you know, check sense of smell, then you're going to get them to, you know, look up, down, to the side, right? You're going to get them to touch their nose, your finger, and then out to the side. Okay, so you're going to go up, down, laterally. Okay, check that out. You're going to check periphery. Oops, you can see periphery. Okay, so then you'll be able to tell. You're going to get them to, you're going to check their pupils, make sure it's responsive. Okay, then we're gonna check top of forehead just lightly, left cheek, right cheek, chin. Okay, then we're gonna go into, we already checked the sides for the vision because that's obtrusion. Facial, we'll get you to close your eyes tightly, open your eyes, you're gonna smile, show your teeth. You're going to, sorry, I had to think for a second. Smile, frown, okay. Then we're gonna check the hearing. So can you hear? Can you hear out of both sides? After that, we're gonna get you to swallow. Okay, test and gag reflex as well at the same time. So that is hypoglossal and vagus. And then in accessory, we're gonna get you to shrug your shoulders. And then last one is hypoglossal. So we'll get you to stick your tongue out. Okay. Oh, I forgot to say, for my bad, I forgot this one. So in vagus, we also need you to say ah. Okay, so just testing out other structures there in the throat and mouth. And then, sorry, so for hypoglossal, it is stick your tongue out. Okay, and then stick your tongue in your cheek. And there you go. So those are the 12 cranial nerves, and if you are being tested for that, it's just to make sure that we're doing our due diligence, that you're going to be taken care of, and that you're going to function the way you need to be. All right, so hope that helps, and yeah, have a great day. Okay, bye guys.